My name is Loretta Stronowski. I'm here with my co-host Ricardo Borges, and we have a very exciting show today. What to do if you have a heart attack in Rocky Point.
Hi, I'm Silvia Terrazas, and I'm insurance agent in Mexico
Who do you work for, Silvia?
for
Which company?
for AXA Seguros.
Good afternoon, everyone. My name is Carla Flores. I am a U.S. health insurance broker.
I'm Fernando Antillon. I'm the director of the Mar de Cortez Airport. We support all the operations here at the airport, and in order to give all the info regarding how to get patients out of here in case of an emergency.
Fernando and Alonso, how does the airport facilitate a medical emergency? Or can you tell us exactly? I'm at my condo and my partner is having a heart attack. What should I do?
The first thing you need to do is go to the clinic or call some clinic and get you stable before use the airport or any air ambulance. What I understand, clinics call us all the time, and we get noticed by them about opening the airport sometimes during the day, but sometimes during the night. We're 24/7, and our normal operation hours are from 8 to 5 every day, but we can open the airport 24/7.
How do I get to the airport, number one? And then what happens when I get to the airport?
Nobody walk into the airport asking for get Aero Vac out of Mexico, out of Puerto Penasco. 100%, a clinic comes, call me, get a hold of us, and tell us that they're gonna get some ambulance come to Peñasco to pick somebody up.
Okay.
But the question for you is, if you live in a few years ago, let me tell you what happens. A few years ago, someone called me from some complex here and says that they were trying to do a inside of the this complex. Well, I'm gonna say the name to be. It was from somebody from Puerto Privada. It was somebody that lives in there, and then she was worried about it, and she says, "We're trying to put up together inside a little clinic. We want to hire HOA, hire a paramedics, and we want to get some kind of information of all the people that lives here. That in case of somebody has a problem, we have some a procedure to go to get treated with the but paramedics on the complex, and while the support from any clinic comes and pick them up and take them to the clinic. This is what the mainly process that the patients are being taken through the years, the far as I know.
They just moved here, Laguna Shores, and she's asking if there is a 911 number.
Yeah.
Do we drive ourselves to clinic?
Yeah, you can 911 is the number to call now, and it will go direct to Nogales to our C5, and they're gonna direct a. Here we use Red Cross still, so we use Red Cross, so they're gonna send a Red Cross and an ambulance, ground ambulance, but.
Okay.
But I think using your program, Loretta, I think every we said with this lady, I can go and look on my phone and my emails to look for the name of this lady, but we said on the table different times. It was like different ideas of how the developers or developments, like I mentioned, the condominiums and the hotels, they should have a contingency program
Sure.
like we have at the airport, but like that, to have a couple people, three or four paramedics, and an office with first response office with paramedics, with the files of people who lives there or people who come and visit Peñasco that wants to share their medical conditions to them. So in case of they got a call from some of the condominiums, so they know that John, he has heart problems or lung problems. They know with what medicine is allergic or et cetera, et cetera. So I think those kind of programs will be very effective that all the developers um, can put in use those kind of programs so they can save life.
That's
Um,
yeah, that's great for the, it's something that the full-time people, obviously, it might be something that we could explore to do
Yeah.
something like that. But what about the people just come for the weekend from New Mexico and, they're not going to have a file. So what do they do?
you know what? Yeah, go to the clinic. Yeah, but the other thing, because now the insurance girl is on the show here on the meeting. The other idea came up to the table those days was that the 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 developer or the condominium complex or the HOA of this hotel or condominium talk to them in order to advise them to get a insurance that cover them air evac in case of they need some they have problems not only in Mexico but all over they travel. But if you can advise your members HOA to get that kind of insurance that says that that is one good thing to have. So with that insurance, with a little clinic or office with the files and a response process or procedure between this clinic and the clinics outside of the condominium complex, and that clinics to the airport, I think that was the flow of information that we were trying to do those days. So I think insurance, clinic, and the condominiums, and those paramedics, HOA, the members, they can pay for it, and that little clinic with the clinics in town and the clinics in town with the airport coordination, that will solve the problem to these people or anybody that got problems here. Even me, everybody, we can have a problem. So I have my own uh, procedure to do it in case of something happen. I told my wife, you call this guy, he will come and pick me up. I have a friend and two friends in Hermosillo, and I have two, three friends in Phoenix. They can come and pick me up in case if I need it. But this is me.
Yeah, but if you have a
But
heart
I'm
attack,
talking,
it's not going
I'm
to work.
talking about it. A lot of people here, they will love this to have this kind of process or procedure. So they need to buy insurance for this lady right here, or
Yeah.
someone that can solve all this. At least It says, you, John Smith, you can be Aero Vac from Puerto Penasco, if you want to say it, to United States or to the clinic that he has that kind of specialty, like the heart or lung or somebody get burned or whatever, you know.
Carla, can you
Mhm.
explain to us, American that comes here, what should they have in their insurance? What does their insurance cover? What are things they need to know before they come to Mexico, especially if they have a heart condition?
Well, first of all, they need to understand that their American insurance will not work here. And there's a caveat to that, but I want to get back to the air ambulance. There is insurance that people can get for temporary international insurance that is not that expensive, and that will cover anything that would happen in that country. However, they need to go to the network. Let's say it's Blue Cross. Blue Cross has an international network, but would be needed to get AirVac to like Hermosillo or Mexicali or someplace like that, because Rocky Point, Puerto Penasco, does not have the facility that could help them at this point. So there is that they could buy that insurance to cover for, let's say they're here for a month or two or a week or a weekend, there's that availability. Let's say if somebody's here a little bit longer. Now, if they are over 65, Medicare will reimburse them for some of their medical expenses. However, they are going to have to pay for them first, and then they will get reimbursed. And every policy, there's differences in the policies that I won't get into between Medicare Advantage and a Medicare supplement plan, but they're an original Medicare. But if somebody wants to know more about that, I'd certainly talk to them. So it will cover some of it, but you still have to pay up front and then get reimbursed. So I think Americans need to know that when they come to Puerto Penasco, they need to be aware of the abilities that we have to take care of them in a heart attack, stroke, or traumatic injury, so that maybe they, again, at least for the injuries, that they're a little more conscientious of what they're doing. But for the heart attack, stroke, I love the idea that there's a protocol, that there's protocols in place for here. All the condominium developments would have that would say, this is what you do if something happens, is 1, 2, 3, 4. So you have some steps to follow. If somebody has, let's say, a supplemental heart attack, stroke policy, which you can get in the US, if it's diagnosed, let's say it happens here and they're diagnosed as a heart attack or stroke in the US, it's first diagnosed there, that policy will work. If it's diagnosed outside of the US, that policy will not have any benefits to it. So there's just, some things that they just need to be aware of.
Yeah, I'd like to ask you a couple of questions with regards to the Mexican health insurance. Any idea how does the Mexican health system respond to medical emergencies in Sonora or here in Puerto Peñasco?
I agree with Carla. It's in Puerto Penasco. It's very difficult because it don't have the infrastructure that they need. But in Mexico, the health system responds, I think, quickly, and it's prepared for this type of event. And I consider that medical care in Mexico is very good. So the doctors are certificated, and the technology that we have is very good. It's high technology. For example, in Hermosillo, in Cima, in San Jose, or in Mexicali, Almater.
Those are hospitals or clinics, right?
Yes.
And is the 65-year old age also applying here in Mexico? ¿Los 65 años también aplican?
Go ahead again. Sorry.
Tienes el mute.
No,
I'm asking her if the 65 years old policy applies also here in Mexico.
Yes, but the law of insurance in Mexico tell us the age for accept people in insurance is 65, is under 65 for first time, but then se puede renovar, pero tienen que contratar a los 65 o antes.
So it can be renewed, but you have to have 65 or less than 65 to renew.
Yes, and
Pero
they
más
don't
de
accept.
65 no.
No, it's very difficult.
Si lo pones aquí no te aparece.
Es difícil que acepten a alguien así.
So more than 65 years old is really, really difficult for an insurance company to accept
For the
policy.
first time.
Unless they are
And-
renewing.
Yes. And
O sea, a lo mejor-
they don't accept pre-existence conditions not covered. For example, if somebody has hypertension before hires the insurance, the company is don't accept that person.
Does it make sense for a full-time American resident?
Sometimes it's required, but most of the time they don't accept.
They don't?
They don't,
Yeah.
right?
No.
Okay, there's a question here that says, is the process different if you have permanent residency and are a U.S. citizen regardless of age? Entonces,
O sea, que sean residentes americanos. Okay.
sí, que tengan una residencia permanente en México, pero
Yes.
son de nacionalidad extranjera.
They can take out insurance. Yes.
Sí pueden.
Sí.
So if
If
you
they're
are a
resident.
permanent resident in Mexico,
Tienen que tener una residencia en México
okay.
para poderlo contratar.
So they
Y
are
de hecho-
eligible as long as they have the residence in Mexico.
San José, ¿quién dices?
Y
And
el seguro se tiene que, aunque ellos permanezcan pocos meses en México, el seguro tiene que permanecer vigente siempre. No lo pueden cancelar y luego volver a contratar porque pierden la antigüedad.
Okay, even if they are just a few months in Mexico, they have to have current the insurance policy always. They cannot just have it on while they're here and then put it off and then on and off.
Mhm.
Interesting. Okay.
And
Okay.
can I
Good to
ask, and it might be hard to answer, Sylvia, but what is the cost for an American that's a permanent resident in Mexico? I know that
The cost, el género y la edad es lo que determina el precio.
Okay. Gender and age will determine the price of the policy.
Yes.
okay. I think it's
It's, for example, woman in 50s, maybe,
More expensive?
yes, like about $3,000.
a year.
A year?
Yes.
Is that
Yeah.
US dollars?
Sí.
Yeah, US dollars. I
Mhm.
thought it was less.
Yeah.
Carla, what about that question for you? If the American is a permanent resident, does it matter?
Well, you can, as long as you have a U.S. address, and you are going back to that U.S. address where your taxes are filed. Most Americans still have their taxes filed unless they've permanently moved here and, have a business or whatnot. But you have your U.S. address in the States and a residence, then you can keep your U.S. health insurance. And so, especially individuals that are over 65 prefer to do that because they can go very easily and get their Medicare will be in place, and they can get all their care taken done either at Phoenix or Tucson or Ajo even. So there's some options there. Under 65, I have individuals as well that still keep their US
38, ¿no?
Sí, me faltó uno
so that they can go and see their doctors in the US when they need to see them.
That info is trying to give you the data or the contact info for a first response for somebody that needs some help in order to get stabilized after suffering some kind of an emergency disease or something. So we have put the phone number of the San Jose Clinic with Dr. Rodriguez, who in the past has helped a lot of patients in order to get them ready for Air Evac in the past. So that is something, at least as a first response information data, that can help somebody,
Okay. So I'm going to post that after the show. Thank you, Fernando, for that. It's Dr. Jamie Rodriguez, and I have his phone number. So I thought it would be a good idea. I don't know how to make this happen. Alonso, Fernando, Ricardo, maybe you can help me, but I just thought it would be good for us to have something that the border can hand out to everyone, like a little card, who would call in case of an emergency, when they're going through
Sure.
card, have a safety
Yeah, for
card.
sure.
Yeah.
I mean, is that something that could be doable here? Do you think that they would allow us to do that? It's not advertising any business or anything. It's just saying, like Jan said, well, we just moved here. You don't want to find out you're sitting at your house in Laguna Shores and, a heart attack's very hard to predict that it's going to happen. It's the last thing you want to do is, okay, now what do I do?
Yes. Yeah, some kind of an emergency card or something like that with some important phones to call just in case of an emergency, something like that.
Even if it's not at the border, we can have it at, at the security gates to all the places that check in, or, Las Palomas. It should be something that they give out to the renters, or, Princesa, wherever, even Los Conchos on busy weekend. Just
yeah, I think, Loretta, those numbers, those emergency numbers, phone numbers, are included in the Rocky Point newspaper that it's handed over to many people. I will check that in just a sec, but I'm sure that those emergency numbers are there. If you allow me, I will check it out and let you know if those are in that newspaper.
I'll be a devil's advocate here, because if I'm coming for the weekend to the bike rally, I'm honestly not going to read the paper, but I might stick a little card in my wallet that had the emergency numbers.
Easier, yeah.
We have a comment. Ricardo, do you want to read that out?
Yeah, it's Elaine Turnbull. She just jumped in, and she says that as a former instructor of CPR through the American Heart Association, she's telling us that the very first thing that should be done is to determine that whether the patient is breathing, and if not, begin CPR. And she says that there probably needs to be a mass CPR class taught throughout Puerto Penasco. I totally agree. Mexican and expats alike. Yep.
So the question is, do we have anything like that now? Do we have any kind of classes? Is there people first responders that are trained? And if so, how many? Does anyone know the answer to that?
That I don't know. Alonso, you know that?
The first I know, Red Cross they train in the fire department. The first that I know, and what she's saying is very important, and I like that idea to train people that to get know how to do CPR. But I understand Red Cross is doing that. I don't know if you, but yeah.
Yeah.
Loretta, I'm looking at the Rocky Point Times, and on page 48, there are a list of clinics, including Clínica San Jose, which I just gave you the number, and a lot of other emergency numbers that will be very helpful in this case, as well as the Red Cross. So at least there is a way of getting that info. It's just a matter of let everybody know that those numbers are here. At
Right.
least already it's here. So
the Rocky Point Times, not only to check out the latest listings, but it might be a good idea to have
yeah,
a copy of that in your house for sure. For the
yeah, and there is also other type of information like first aid and emergency kind of info.
yeah. Okay.
Yeah.
What else was I going to ask?
Carla, we were talking about this kind of requirements or requirements in health insurance up in the States the other day, and I'm not sure if you have said this today, but you were saying that in order to be covered down in Mexico for heart attack or kind of, you have to be diagnosed first over there, so you're covered. Am I right?
No, if it's diagnosed in Mexico, your American health insurance will not work. Again, this is under 65. Medicare, again, that's for over 65. They will pay for a little bit of care, but you have to pay for it first, right? And then it's reimbursed. But if you are diagnosed, let's say you're 55 years old, have a heart attack, and they diagnose it here, then your U.S. health insurance they won't cover it because it was diagnosed out of the United States. If it's not diagnosed here, but you get to the United States and they go, oh, yes, no, we're running all the tests. We can see that you've had a heart attack. Because I guess my question was, and when the doctor gets here, again, we can talk about this, but how stabilized, what tests do we have to determine here whether or not that is a heart attack? Outside of just guessing, but there's labs that can actually be done to determine whether it's a heart attack. So that's a good question for the doctor. And we spoke about that a little bit prior to our discussion here. Does that answer your question?
Yeah. Thank you.
Mm-hmm.
Yeah. There's another question here. Is there a local TV station that can teach CPR just to give people an acquaintance with what we do? I don't know that. If you can get an AID to a victim within 5 to 6 minutes, the chance of survival jumps significantly. Where can AED be safely placed in BC areas such as guard shacks? And she's saying that those are very user friendly. And how can they be funded? Yeah, big question.
Good question.
I don't have an answer in line to that, but we can find out.
And maybe you guys know, maybe you don't know. The doctor told me last week that there wasn't any. He said are there any defibrillators in Rocky Point?
I think what I understand, they do have this kind of equipment for heart attack and down.
Where Where do they have it?
Yeah.
Where?
At the
Clinic?
And I think on the Navy hospital, or I understand Rodriguez has,
at the
and
San Jose Clinic.
and I think the Naval, the new one, Naval Clinic. Uh, uh, we have a security program at the airport, and uh, we need to renew that. We do it every year. We do an inventory about nurses, doctors, all that kind of equipment, emergency rooms, and all that. Uh, in order to have, we call it external support for any incident or accident here. So, in order to do that, in order to support this security program, we need to have that inventory. And to be honest, on the next weeks, we're gonna go and renew it. So maybe in a couple of weeks, we will have more info, like updated information about how many doctors, how many nurses, how many beds, how many different everything, and contact information about everybody, because this is part of what we do here. But to be honest, I understand there are few in town of those, because this is a very common question people ask me when they come to Peñasco. This is
Sure.
one of the first questions they ask, and I am very positive. They have a few here in town. That I don't remember. I need to go into the book. But what we do is any problem, we just have the number and the phone, and we call whatever we need. We don't have any issues at the airport, but it's backwards. The clinics call us and letting us know that air ambulance is coming to pick somebody up.
Francine is
But
asking
but
about that too. If there's people that are trained to use the defibrillators, or
Yes.
yeah, if they have it, they have to know how to use it, right?
but we don't know where they are right now.
We know, and we have our fire department inside of the airport, and I have a firefighter chief and our team paramedics and all that, and they get trained every day on that. So
But the airport's too far. If someone has a heart attack to use the defibrillator.
we don't have defibrillators at the airport. We don't, but we have exactly know through our paramedic, through our paramedic, or through our fire department, who has it, how many, and where. But like I mentioned before, in a couple of weeks, if you allow us, we'll give you updated information about what's the inventory on this town about, because it is part of what we do. We need to know what is in town.
Of course. And coming from being a realtor here and selling homes to people who, whether it's full time or they want to come for vacations, why people move to places is there's two things that are important to them. And number one is security and safety. So they want to be in a place where they feel safe. And number two is they want to know that the healthcare is, they're going to be okay there if something happens. So on that note, we have the doctor just joined us. Thank you. I am sure you were busy in an emergency. So why I asked you to be on the show was because you have your pulse on what's happening in the healthcare system in Rocky Point, and we were just talking about defibrillators. And are there any here? Are there people who are trained to use it? What, in your opinion, what if I have a heart attack, what should someone do for me?
Well, first of all, as I don't know, you already talked about, or we talked about some time ago, a little bit about it. Like in any emergency, it's crucial. Time is crucial. Like we say, we are in it's the golden hour, the first hour of any emergency event. So that will depend our prognosis about the first hour that we attend you. So depends on where you are. So most of the time we are at our condo, our houses, or anywhere at the street. Like it happens anywhere. So the first thing to do is to call an ambulance or to have at least numbers of the ambulances or of the clinics from here, so they can go for you and have the first steps. That like the first steps um would be like assess to be sure you're having like some symptoms, signs and symptoms of a heart attack. And I don't know, you have talked about the, well, what, how can you think about you're having a heart attack?
We haven't, but that's a good. Tell us what. I mean, we read it, but it's a good back to basics. How do you
Well,
know if you're having a
it's
heart attack?
it's 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 easily to get confused with a heart attack with a lot of things, because it's not like if you have certain symptoms that will tell us, but there it's like you can feel like a heartburn, you can feel your left like pain in your left arm, you can have headache, you can have breath shortness, you can have like general symptoms like like feeling weak. Like it's not like you can you can get confused like heartburn too. So you can get confused. It's easy to get confused with other symptoms. Maybe you can think you had gastritis, that you have maybe headache because of the sun, or maybe you've been feeling like tired or something like that. So you need to know your body first of all. You need to know like what's normal in you, you know.
Yeah, and it's better to be safe than sorry. I remember, I think it was last month, the guy who was on the jet ski, the jet ski people said he was complaining that he had pains in his chest, but he went out on the jet ski anyways, and
That's right.
it didn't end well. But you know, we can't just say, oh, it's nothing.
So maybe he thought it was indigestion, like maybe it was the food, maybe it was the beer, maybe it was something else, and
Sure.
that's the thing, that maybe sometimes it's 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 very important to everyone to know their situation about their body. You have a window.
Doctor, doctor, how effective is 911 here in Mexico? You know, how good is that number for this kind of emergencies?
Well, sometimes, something I didn't tell you is that I work on private, so sometimes it's because it depends on the city, on what they're about their situation. So here in Rocky Point, we have like a lot of tourism, you know. So we have a lot of ambulances. So when you call 911, they will they will reach like Red Cross or the ambulances that are available. So they will dispatch one for you so they can take care of you. That will be like kind of the process when you call 911. So they will contact you to the people that you need, so they will take care of you. Here's Melanie in laboratory. Time is essence in a heart attack situation. You have a window of 6 to 5 minutes, not enough time to load a patient into a car and drive them to the clinic. I believe it will be have all condos to ship in to have an in their premises. So uh, I don't know. You read the Elaine's
Yeah.
comment. So well, Elaine, it's fundamental, or will be the best for everyone, that not only the condos or the sites of the like places to have like in strategic places where they could reach easier for some places, like having that will be wonderful. But the thing is that sometimes we lack not only of equipment but of but of people trained to take care of this situation. So that's why we don't have like enough people trained to take care for everyone. That will be wonderful. That if the tourist area will have, maybe they could get in arrangement to have one ambulance or two for that will be close enough to attend a situation of this. That will be wonderful.
What if they? So she's saying, can they have a defibrillator in each condo project, like one at Las Palomas, one at Princesa, one at Las Conchas?
That will, I think they will need to have it. I think they will need to ask if where they live they have it, or if there's someone like an MD or a paramedic that will take care of any situation of that. In the meanwhile, the ambulance come by.
Right. Can you explain for people who don't know what a defibrillator does?
Well, when we have a heart attack, well, our heart won't be giving that, will be like it will be like it will be with movements, irregular movements. So the defibrillator will get him back on track to get the normal uh, heartbeat. So the heartbeat will be like, will be not coordinated. So the defibrillator will restart our heart to have the pulse it should go.
So that's why can save you.
It's like, it's vital to have a defibrillator as near as possible for for all the parts of Puerto Penasco, Rocky Point.
But it's not hard to learn how to use it, right?
That's right. There are some defibrillators that are for personal use that you can buy. Like, they're like small packs that they will teach you in case that somebody happens, that you don't need like to be like such a specialist, that they will tell you where to put the band, so you can give him a shot, so maybe you can save a life with that.
How much
Are those
do they
expensive?
Yes.
They're not as expensive. They're like $800-$900.
Oh,
Is
that's
that right?
And they're like compact, like a real emergency ones. Like Elaine say, like if you have one of those on each like hotel or condo for each people, that you can only buy the consumables. Like you can have pads for children, for younglings, or for adults, like the paddles. They're exchangeables.
So, doctor, I have a question. So, let's say there's a situation and somebody thinks they may or may not have a heart attack, but then somebody uses that. Maybe it's not. Maybe it's a gallbladder. Maybe it's indigestion. Maybe it's, the other things you were talking about. So, that might be detrimental to that person rather than helping them. So is that a challenge, do you think, that unless we train the person that was in charge, maybe a person at each development that was trained to know the difference? Or is that something that a doctor really needs to determine?
Well, it's the best thing that will be that the situation is that, best of all, is that someone trained for that to assess. But if there's no one around, it won't be it will be preferable to shock him than not to give him the benefit. You wouldn't use it unless they're unconscious.
Elaine has extensive training in what we're talking about, so she knows. That's true, right? You don't use the defibrillator unless people are unconscious.
You wouldn't use it unless they're unconscious. I don't really understand the.
So you don't use the defibrillator unless the people are unconscious. Like,
Oh, well, you will. That's why, like Carla said, like you will need to assess him to do the to check the patient or the people, so you will know you will need to use it or not. But in the case, most of the time, you won't have someone that is trained to do this.
but you don't use it if someone says that they feel like they have indigestion. You don't use it on them.
That's right. So that's what I told you. That's what I told you, that you need to at least know the most of your patients. It's not like you will think that a 30-year-old person will have a heart attack. It is not normal. Not that that he hasn't, that not could have, but you have a patient that is 70 years old that takes pills, that has hypertension. That it's so the probability will be a little bit higher. He has chest pain. He has he, so you don't use the defibrillator on people. You will take him to the doctor unless, like Elaine said, like when it stops, he gets unconscious. You will think the heart stopped. You know, I think that's what she's trying to say.
Right. Yeah, exactly.
Hey, I just asked Hector Vasquez from Las Palomas Resort whether they have defibrillators, and if they do, if they have trained people. He just said yes, they do have defibrillators, and that the paramedics they have on site are well prepared to use them. So good to
Oh,
know.
that's right.
So I guess on that note, we know that Las Palomas has it. And if you're watching this and you are a resident at a condo project or whatever, it's in your best interest to ask the HOA if they have a defibrillator and if they have someone who's trained to use it.
So Fernando and Alonso need to go to a meeting. So thank you very much, both of you, and hopefully we're gonna have you again sometime soon.
Much.
Yeah, Alonso, I'll be waiting for your update.
Okay, okay. I'm glad to
Gracias.
help. Anytime. Yeah.
Thank you very
anytime.
much, guys.
Dr. Luis, you and I were talking last week that what's important when you move to some places, safety, security.
Yeah.
You were the one who said to me that education, is a big thing. So, we have things that we give money to. Everyone knows that I'm a big proponent of Barb's Dog Rescue because I have dogs. But I mean, if there's something that us, as Americans, Canadians can do on the side of the healthcare industry, I think we need to know that because we really don't know.
Like a foundation or association you can work with for the health system.
Well, not necessarily that, but it's okay. Well, do we need defibrillators here? Do we need to send people to school? Do we need to have a class that teaches people CPR? I mean, so if I come from Phoenix or Tucson or Dallas, I can feel safe that I don't have to worry about something
Yes.
bad happening to me.
Well, like Ricardo told us, like he said it. So he asked about the palomas. So we will need to be sure that in the rest of the places they have trained people and the equipment to take care of the emergency. So the ones that don't have, they will need to look for someone so they can give more security to their people.
Well, yeah, and it might be something for the HOA associations if their building doesn't have one, that should be a priority.
That's right.
If there are
Because
$800, that's not a lot of money when there's 400.
Very well.
So everyone will feel safer if they know they have the minimum, at least, for them to take care of the emergency. In the meanwhile, they go to the place. They will give him the whole treatment or the whole thing. So if they have paramedics, if they have an ambulance, those, I think the people that come here will always ask, like, will be the same. They will ask for safety, health system, and, well, like I told you, it's education, no? But they will always ask for these things, so they will feel safer are where they're landing and where they're living.
Of course. We had Sylvia talk about the healthcare insurance. Sylvia, have you had Americans or Canadians that live here full time in Mexico? Have they purchased insurance from you?
No, I don't have it, but I know that some agents in Puerto Penasco, they have people, foreign people in AXA.
Because it might be something that's like a override, I think, Carla, what are your thoughts?
Yeah, that's possible. And then the international health insurance that you can get. Like I said, there's Blue Cross and Blue Shield that does global health insurance. For people that are here, maybe just for a weekend or so, they might want to think about that. But again, they would be going to a larger hospital facility like Hermosillo or Mexicali because they're in the network and they have the facilities. So again, it comes down to what facilities do we have to treat the case. And I know the doctor, we've talked about this a little bit of what's needed in Puerto Penasco in order to, have the labs and the imaging and all that to really determine and to diagnose what something is, and then to have the hospital or treatment center that can treat it. Once we have that, right, we can draw the specialists, the cardiologists, and all the other folks, all the physicians and the medical staff that can make Americans, Canadians, or those of us that live here a bit, feel a little bit more safer about our health, if something does happen. So I think it sounds like we're in process. And I think that collectively that we can promote, the safety by having the defibrillators, if I could say it, in the different developments. Maybe, I don't know, but come together as a collective and just promote that. It's very important.